Hello everyone. Today we are going to be discussing the objective paper of Veterinary Pathology Part 1. This paper was the annual examination paper of the year 2022 and was set by Rajasthan University of Veterinary and Animal Sciences Bikaner or Rajuas. So let's begin with it. The first fill-up is dash pigment is an important marker that indicates whether the cell has suffered free radical injury. The answer is lipofuscin. During necrosis, earliest recognizable nuclear changes is dash, which is characterized by nuclear shrinkage and basophilia. That is pycnosis. Argyrosis is a deposition of silver in the lungs. Iron, for iron deposition, we call it siderosis. Circumscribed hemorrhages up to 2 to 3 centimeters are called as dash, ecchymosis. Dash tumor in the wall of the lower esophagus in the dogs are caused by Spirocerca lupi parasites, that is fibrosarcoma. Dash is a reversible change in which one adult cell type is replaced by another cell type within the same germ layer, that is metaplasia. Rodent's ulcer or Jacob's ulcer is a common name of basal cell carcinoma. White thrombus mainly contains WBC, that is leukocytes. Specific gravity of the urine is inversely proportional to the urine volume. Abscess is an example of dash type of necrosis. Abscess is always an example of liquefactive necrosis. Inflammation of the suspensory ligament of the uterus is parametritis. Dash means the incomplete distension of the alveoli, atelectasis. Laryngeal hemiplegia occurs in horses, mostly due to injury to the dash nerve, left recurrent laryngeal nerve. This 1.14 question is something that I couldn't find the answer of. So if anyone knows the answer of this question, please let me know in the comments. Dash is the degree to which the lesion is elevated or depressed with respect to the adjacent tissue. For the diagnosis of rabies in cattle, cerebellum part of the brain is collected. GID is caused by larvae of Cineris cerebralis. Inflammation of the gallbladder is called as cholecystitis. In ESR, the distance by which the RBC fall during a given period of time is measured in mm per hour. Dash is known as programmed cell death, that is apoptosis. Brain hemorrhage is known as apoplexy. Now we move on to the MCQs. Prolonged starvation leads to muscle atrophy. Okay. Lack of blood supply is known as ischemia. Here you should also read about paradoxical emboli. Deposition of iron particles in the lung is known as we discussed before, it is known as siderosis. Plumbism is a deposition of lead, anthracosis is a deposition of carbon particles, and silicosis is a deposition of silica dust. Xanthomas is the skin. Xanthomas in skin is the accumulation of macrophages laden with cholesterol, which is not a cardiac thrombi, saddle thrombi. Chemical nature of amyloid is protein. Mucinous degeneration is characterized by increase in number of goblet cells. Erythroblastosis fetalis is an example of type 2 hypersensitivity. The inflammatory cell with bilobed nucleus and blue colored granules in cytoplasm is characteristic of basophils. Liver mortis is staining of lower portion of the body, of the dead body. Tremors are mild spasms. Presence of albumin in urine is tested by Robert's test. Rothera's test is for ketone bodies, Benedict's test is for glucose, and O'Donoghue test is also for glucose. When water is present in peritoneal cavity, the condition is known as ascites. Absence of spinal cord is amylia. Diabetes mellitus occurs due to damage in pancreas. Variation in the shape of RBCs is called as variation in shape. Keep in mind, variation shape is known as poikilocytosis and variation in size is anisocytosis. And erythrocytosis is increase in the number of RBCs, which is not a type of goiter. Granulous goiter is not a type of goiter. Opacity of the lens of the eye is called as cataract. Telescoping of anterior portion of intestine into the posterior portion is known as intussusception, condition which is also known as adult rickets is osteomalacia. Okay, this is all for today. If you want any other papers to be solved, the objective part of it, please let me know in the comments below. Thank you.